Assalamualaikum warahmatullahi wabarakatuh. Welcome to today's lecture on the fundamentals principle of phlebotomy. I'm presenting the 10 rules of phlebotomy by Dennis J. Ernst, which serve as an essential guide for the safe and effective blood collection practices. These rules are not merely suggestions, they are critical standards that every medical laboratory technologist must master to ensure patient safety, specimen integrity, and professional competence. As future MLT professionals, you will be responsible for collecting thousands of blood specimens throughout your career. The techniques and principles we discuss today will form the foundation of your phlebotomy practice and directly impact patients' care outcomes. I would also like to take a moment to remind you that everything we have covered throughout this course is summarized in these 10 key rules of phlebotomy. These rules are crucial for ensuring proper technique, patient safety, and the accurate collection of clinical specimens, which are essential to your success as competent professional in the field. Let's look at these rules one by one. Rule number 1. You should protect yourself from injury. Let's begin with the most critical rule, your personal safety. When drawing blood, you are potentially exposed to at least 20 communicable diseases, many of which are life-threatening and some incurable. These statistics are sobering. Approximately 1 million healthcare workers sustain accidental needle stick annually. The consequences are severe. Thousands of these workers contract hepatitis, and 50 to 60 become HIV seropositive each year. What's particularly concerning is that hollow bore needles, exactly the type we use for blood collection, accounts for 68.5% of all needle stick injury. Wing infusion set, commonly called butterfly needles, are responsible for 35% of these accidents. Perhaps most alarming is that up to 92% of needle stick injuries in the lab setting go unreported. This underreporting prevents proper medical follow-up and skews our understanding of the true scope of the problem. Your protection strategy must include consistent use of personal protective equipment, PPE, proper needle disposal technique, and avoiding wing infusion sets when possible. Remember, every safety protocol exists because someone before you was injured. Learn from their experience, not your own mistakes. Rule number 2. You should identify the patient. Patient identification's error can be fatal. This rule requires 2 acceptable methods: checking an identification bracelet affixed to the patients or asking the patients to state their full name. Notice I said state their name, not simply confirm it. Why this distinction? Sedated or semi-conscious patients may respond affirmatively to any questions, creating a false sense of security. By asking them to state their name, you are requiring active cognitive participations that better ensures accurate identification. In emergency situations where full identity hasn't been established, temporary identifiers like a science number are acceptable, but must be updated when complete information becomes available. When neither bracelet nor verbal confirmation is possible, have the patient's nurse or caregiver identify them and document who provided this verification. No shortcuts are acceptable here. The consequences of misidentification extend far beyond a mislabeled tube. They can result in inappropriate treatment decision and patient death. Rule number 3. You should puncture the skin at about a 15-degree angle. The angle of needle insertion is crucial for successful venipuncture. Most textbooks recommend 15 to 30 degrees, but I want you to aim for the lower end of this range, approximately 15 degrees. This low angle serves multiple purposes. First, it provides a greater margin of error when judging penetration depth. Second, it significantly reduces the risk of passing completely through the vein, a common cause of hematoma formation. Third, it minimizes the chance of provoking underlying structures such as nerves, tendons, and arteries. Think of it this way. You are not trying to spare the vein, you are trying to tread into it. A shallow angle allows the needle to enter the vein and travel within the lumen rather than punching through both walls. While you don't need to carry a protractor, developing a consistent low-angle approach will dramatically improve your success rate and reduce patient discomfort. Rule number 4. You should glorify the medial cubital vein. Of the three primary veins in the antecubital area, the median cubital vein located in the middle should be your first choice. This preference is not arbitrary, it's based on 4 significant advantages. First, it's more stationary than the other veins, making it easier to hit and less likely to roll away from your needle. Second, puncturing it causes less pain to the patient due to fewer nerve endings in this area. Third, it's usually closer to the skin surface, making it more accessible. Fourth, and most importantly, from a safety standpoint, it's not nestled among critical nerve or arteries. Your assessment technique should be systematic. Always check both arms for a suitable median cubital vein before considering alternative. If the median cubital vein is not prominent enough to instill confidence, your second choice should be the cephalic veins on the lateral or thumb side of the arm. Reserve the basilic vein located on the median or inside aspect of the antecubital area as your last resort. The proximity of the median nerve and brachial artery makes this area highly risky. Most permanent nerve injuries and arterial punctures result from misguided attempts at this vein. While it can be punctured when it's the only viable option, unsuccessful attempts that lead to probing in this area subject patients to potential excruciating pain and permanent injury. Rule number 5. You should invert tubes containing anticoagulants immediately after collection. Specimens rejection due to clotting is entirely preventable, yet it remains a significant problem in laboratory medicine. Tubes containing anticoagulants, particularly lavender top EDTA tubes and blue top citrate tubes, must be inverted immediately after collection to ensure proper mixing with the anticoagulant. The inversion should be gentle but thorough, typically 8 to 10 times for most tubes. If you cannot invert immediately during collection, do so as soon as possible after completing the draw. When using a syringe for collection, time becomes even more critical. The moment blood enters the syringe barrel, the clotting cascade begins. If the time from syringe filling to tube evacuation exceeds 1 minute, significant clotting may occur. This not only makes specimen transfer difficult, but can create microscopic clot that go undetected yet affect test accuracy. Remember, every clotted specimen means another needle stick for your patient. This rule is not just about specimen quality, it's about patient care and professional competence. Number 6. You should attempt to collect specimen only from an acceptable site. Site selection directly impacts both specimen quality and patient safety. Antecubital and hand veins are your primary acceptable sites, unless contraindicated by IV infusions, injury, or mastectomy. Avoid the anterior or palm side of the forearm entirely. This area has nerve and tendons very close to the skin surface, making injury highly likely. The risk to benefit ratio simply does not support using this site. Foot and ankle veins present special considerations. While they may be acceptable in some facilities and for certain patients, they carry significant risk. Puncturing these sites can lead to thrombophlebitis and clot formation, particularly in patients with coagulopathies. In diabetic patients, poor circulation can result in tissue necrosis. Before considering foot and ankle puncture, verify your facility's policy permits it and obtain physical approval. The increased risk of complications requires this additional level of authorization. Rules number 7. You should label specimen at the bedside. There is absolutely no excuse for not completely labeling specimens at the bedside. This means full identification, not temporary markings intended for later completion. The consequences of mislabeling can be fatal. Consider this actual case. A laboratory technician drew a blood specimen for typing, left without proper labeling, collected from 2 more patients, then returned to type all 3 specimens simultaneously. After an interruption, she misidentified the specimen and typed 1 patient incorrectly. The patient received incompatible blood and died. Despite decades of emphasis on this principle, delayed labeling practices persist. Some facilities have observed collectors writing patients' last name on tube caps as temporary identifiers. This practice is dangerous and unacceptable. The bottom line is non-negotiable. Label specimens completely at the bedside every time, without exception. Your patient's life may depend on it. Rule number 8. You should stretch the skin at the puncture area. Proper skin stabilization serves 2 critical functions. It anchors the vein and reduces puncture pain. Using your non-dominant thumb, pull the skin taut from below the intended puncture site. This technique is particularly important when assessing the cephalic or basilic veins, which tend to be more mobile. Stretching the skin is the single most effective method to minimize puncture pain. When skin is loose, the needle pushes the tissue ahead of it before penetrating, creating a larger, more painful opening. Taut skin allows for clean, sharp penetration with minimal tissue displacement. This technique offers 2 significant benefits. Your success rate will improve because you are working with a stabilized target, and your patient will thank you for the reduced discomfort. It is a simple technique that demonstrates your technical competence and patient consideration. Rule number 9. You should know when to quit. Professional humility is essential in phlebotomy. Not everyone can draw blood from every patient, and even experienced phlebotomists encounter difficult situations. Recognizing your limitation is not failure, it's a professionalism. After two unsuccessful attempts, seriously consider calling for assistance. This guideline protects both you and your patient. For you, it prevents the frustration and loss of confidence that comes with repeated failures. For your patient, it limits trauma and discomfort. Remember, some veins seem to exist solely to humble overconfident phlebotomists. When you encounter one of these challenging cases, swallow your pride and seek help. Your patient will appreciate your consideration, and your colleagues will respect your professional judgment. Persistence beyond reason is not dedication, it's stubbornness that serves no one's interest. And finally, rule number 10, you should treat all patients as if they are family. This final rule encompasses the philosophical foundation of healthcare practice. In a hospital environment, patients are often frightened, uncomfortable, and vulnerable. The peace and comfort they experience frequently comes from the healthcare professionals who interact with them. Your kind words, gentle techniques, and genuine smile may be the only positive elements in a patient's difficult day. Regardless of how you came to work in healthcare, consider yourself chosen for this role because of the unique comfort and compassion you can provide. This perspective transforms your work from merely collecting specimens to providing healing presence. You have not just been employed, you have been entrusted with the privilege of caring for others in their time of need. Approach each patient interaction with this mindset, and you'll find greater meaning in your work while providing better care to those who need it most. As a conclusion, these 10 rules form the foundation of safe, effective, and compassionate phlebotomy practice. They address technical competence, safety protocols, and professional ethics, all essential elements of your role as a medical laboratory technologist. Master these principles, practice them consistently, and remember that every patient interaction is an opportunity to demonstrate your professionalism and provide excellent care. Your technical skill will develop with experience, but these fundamental rules will guide you throughout your career. As you begin your practical training, carry these rules with you. They represent decades of experience of hard-learned lessons from the phlebotomy community. Learn from this collective wisdom and contribute to the continued advancement of our profession. Thank you for your attention, and remember, excellence in phlebotomy begins with mastering these fundamental principles. Assalamualaikum warahmatullahi wabarakatuh. Thank you again.